Okay, so ask me the question now that you're recording.
Okay, so you worked in the hospital dealing with people who were dead, dying, very close to death. I mean, this was your work, and so did you see, hear, or experience anything paranormal?
I wouldn't consider it paranormal.
You consider it normal?
I would consider it normal and medically explained because people would claim that, when you'd have different gatherings and you'd hear somebody say, like at school, one of the girls said that her grandpa died and they were getting ready for the funeral and he came back to life and sat up in bed and talked. And I kind of chuckled. And I'd already been working at the hospital. I started working at the hospital when I was 16 years old. I did coding of all the people's charts
This was Hayes.
at the old St. Anthony's Hospital. And so I got to read, in order to code, I had to read the doctor's notes and stuff. So I got to read a lot of different weird things that would happen. And I just used the word weird.
That made it into the reports.
Well, yeah, because they reported everything so that it could get coded correctly.
I mean, in other words, billed.
Right.
Okay.
But it didn't mean that there wasn't a medical explanation for it. It's just something that happens once in a while, not to every person. But, okay, for instance, when I ran the ambulance service in Ellis for 10 years, I, on occasion, had the opportunity to go into people's homes and pick up somebody or actually start working on somebody in their home who'd had a massive heart attack and basically was either gone or well on their way out. And we are trained that you do CPR, but once you do CPR, you can't stop.
Right.
Unless the person responds and spontaneously breathes on their own and their heartbeat comes back, or you get to the hospital and the doctor takes over from that point and decides whether or not to continue. And so, in one instance that I can tell you that I witnessed myself, that I didn't have to read about it, I witnessed it and it made more sense after having just read it, thinking, I wonder how this really happened, I mean, they didn't go into great detail. The doctor didn't go into great detail about what happened, just said, the body was making noises and grunts and groans and eyes opened up and head lifted off the pillow and that kind of thing. And so, was that paranormal? Well, in a movie it might be.
Well, after they were clinically pronounced dead?
After they're clinically pronounced dead. And basically
that means no vital signs.
All it is the autonomic nervous system twitching, and you still have synapses firing in the brain. So the brain hasn't completely died. And you have synapses firing, and it controls muscles. And when you do CPR and you are forcing air into somebody's lungs, you're not only forcing it into their lungs, you're forcing it into their stomachs. So here you are doing compressions, and you're either making them belch or pass gas because their stomach gets so full of air as well as their lungs. And that also causes them to, as they settle, to moan and groan because the air is coming between their vocal cords, which is what makes noise. And so you're standing there, the body's been pronounced, person been pronounced dead, the body is there, and the family's coming in, and they're standing there, the doctor's talking to them and whatever, and all of a sudden, the person groans, and maybe the arms come up and lay back down again, or the eyes open up, or the head comes up, or they belch real loud, and then groan as they lay back down like, ooh, that was a good one, And And all of that has a medical explanation for it. That's not paranormal. Paranormal to me would mean somebody actually standing up and walking around and getting into the liquor cabinet and taking a drink of liquor or something like that.
Well, surely you heard of near-death experiences.
Well, I've heard people talk about their near-death experiences.
And these are people who've been clinically dead or in the dead state for minutes, and then suddenly there's a heartbeat or whatever.
I experienced it myself when I had my car accident in 1970 when a drunk hit me head on a blind curve on Old 40. And I almost lost my right arm, was barely hanging on, so I'd lost a lot of blood. When they picked me up, and back then they didn't have ambulances, they put you in the old hearse that they went around and picked up the dead bodies and took it back. And of course, then they used a nice big black fancy one for the funerals. This was just an old station wagon, and it's got a stretcher in it, and the mortician's wife came to pick us up at the accident site and take us to the hospital. So no medical treatment whatsoever. A farmer saw it happen, was in the field working, and my car rolled end over end and sideways. And the drunk that hit me, his car drove over the top of ours and went into the ditch and up into the field that he was plowing, and it rolled several times. Well, those two occupants got out and were walking around, so the farmer came down to where we were and saw how much I was bleeding and put his belt around my upper arm and tightened it so that I wouldn't bleed to death. And I was still talking. I couldn't move, and I could barely open my eyes, but I was telling Great Aunt Edna, don't let the kids see me. I just knew that I was bad.
Okay, so you're laying there, you're bleeding, you're conscious, semi-conscious that you know what's happened and where you are, but at the same time you're having a conversation with
Great Aunt Edna, who was in the car with me with my two kids.
Right, so she was in the car with you.
And I said, Edna, she said, I'm right here. And she said, Charlene, it's bad. And I said, I know it is. I just don't want you to let the kids see me. Don't let them come over here. She says, okay. And two ladies had been following behind us. My son went through the windshield in his car seat and all, across the highway and into the other ditch. They rescued him and brought him over, and they were sitting with Edna, taking care of the two kids. My dad actually came out to the scene and passed the hearse taking us to the hospital. So he didn't see.
Okay.
So he didn't see us.
Just one thing. I think when you're traveling at 40 and the other car is traveling 40, you're actually hitting at 80?
No, Old 40.
No, I'm talking
The
about
Highway 40.
the physics of when you get into a car crash. If you're traveling 40, the other car's traveling 40, you're hitting.
The force of the hit is
double.
Equal to the speed and the impact of the two.
Because that's horrendous that your son sitting in the back seat, was it, went through the windshield?
In his car seat.
Oh my God.
Car seat and all.
So this guy must have really been traveling.
Well, the lucky thing is he's the only one that died.
Wow.
And the only reason he died was because he didn't listen. He kept getting up when they took those two guys to Hadley because they were the least injured. Visibly least injured. He had a broken rib, and because he kept getting up and going into the room where his buddy was, wanting to know if he was okay, they kept telling him, go lay down and stay there till we can get in and take care of you. But the other kid had a big gash on his forehead, blood everywhere, and so they were trying to get him stitched up. Well, he came in one too many times, and he was standing there arguing with the nurse, and she said, you need to turn around and go back to your room. And he collapsed right there and was dead before he hit the floor. That piece of rib broke off and severed his aorta, and he bled to death internally.
All right, so you're
now I'm in the back of the hearse, and we get to the hospital, and Edna and the two kids are sitting in the front with Mrs. Windholz, the mortician's wife, and they had radioed ahead and said that, the hearse was on its way to St. Anthony's. And Blackie Augustine, who was my dad's partner, when he was on the police force, and my dad was the undersheriff at the time, he got called out to the accident site, didn't recognize the car. And oddly enough, he had a picture of these two little shoes with socks in them that my daughter had come right out of her shoes and socks. They were sitting side by side on the side of the road.
That's weird.
And he had a picture of it. And Blackie Augustine recognized me right away and radioed my dad and said, "You need to get down here to St. Anthony's Hospital ASAP." And Dad says, "What's going on?" And he said, "I don't have time to talk to you, just get here." He wasn't going to tell him on the radio what was going on. And so Dad thought, one, either there was somebody dying, or two, there was a drunk involved, and they needed to get before they gave any kind of medication, they needed to get blood alcohol. And so he comes flying down and parks and walks in the emergency entrance and comes down that ramp, and there's Great Aunt Edna sitting there holding Melissa, and Dr. Eddie had Mike in one of the examination rooms trying to figure out what he was going to do with all the thousands of little cuts this poor little baby had all over him. And I was in the main part of the ER with Dr. Carlson, who was one of the orthopedic doctors. He was the younger one. He and Maddock had started that clinic in Hayes, the ortho clinic. And so Edna said, "You got to go in there. Charlene's in there, and it's pretty bad." And so he walked in, almost passed out, and came around the corner, and he's talking, and they couldn't get a blood pressure on me. They could barely hear my heart beating. They were running blood, had IVs going everywhere, and I can hear, but I can't do anything. I couldn't move my pinky, I couldn't move my legs, I couldn't move anything.
But you were consciously aware of everything going on?
I couldn't open my eyes, but I was totally aware of what was going on. I could hear every word that was being said. And he said, "Ernie, I'm sorry to say," he said, "I don't know if she's going to make it or not." He said, "This is pretty bad." Well, this is what it looks like today. And so he says, I've always wanted to try to reconstruct somebody who's lost a limb to see if we could save it. It's always better to keep your own than it is to have a prosthesis, especially back in 1970, which is when this happened. And he said, I'll be totally brutally honest with you. I don't think she's going to make it. He said, but I'm going to go ahead and I'm going to try. And so I thought, I'm not dead, but I couldn't say anything. I couldn't move. I couldn't do anything. And they took me into OR. And as they were putting me under, this is no joke. It was like the most brilliant light and difficult to see anything, to tell exactly where you were or anything. I'm not saying that was an out-of-body experience. I'm just saying, all I can tell you was that there was this very, very, very bright white light. And I can hear the anesthesiologist talking. I could hear the machinery making noises and stuff. And I have no clue how far into the procedure or not that this actually happened. I have no awareness of time. And then it was like, blink, everything's gone, and I'm out.
Like asleep or passed out?
Yeah.
Next conscious thing you realize?
I didn't come to until it was the week before Mother's Day. This happened on April 12th, and the week before Mother's Day in May was when I came to. Wow. And they moved me out of what they called ICU. I called it expensive care. And they put me into a regular room and everything. And Dr. Carlson would come in and change the dressings and stuff like that. So I don't believe that was an out of body experience. I believe that that was an end of life experience because I was that close to being dead.
Were you feeling no pain?
No, I could still feel pain, but I couldn't say anything about it. I couldn't do anything about it.
But you described that there was a timeless aspect to this, right?
Yeah, it's just kind of like time wandered around and, you know, but I can tell you that I, not only within the almost 40 years that I practiced medicine, practiced as a nurse, not a doctor, but that I was involved in the healthcare field, most of it in the ER or on an ambulance, that I have witnessed things that have happened after people have been pronounced dead that have to do with very easily explained medical conditions that cause it. It might be frightening to the family. It might give them a totally different perspective of what they think it was. You know, great Uncle Fred, yeah, he got up and walked around, got a drink of whiskey and sat back down in his chair, and then he was gone for good. You know, just different things like that they said. And we know they're not able to get up and walk around.
Well, like, for example, you're dead, you're on the operating table, and you feel your awareness over, above, and top you. And
No, I didn't feel that I was above or on top of anything. I'm just saying that wherever I was, I can't say I was inside my body or out of it. That's not what I experienced. What I experienced was this intense white light to where you couldn't
see anything else.
Recognize shapes or anything like that. I mean, you knew that there were people there and you could hear them talking, you could hear the machinery, but you couldn't see it.
And previous to that, you could perceive?
I could perceive that the anesthesiologist was right here. The doctor was right here.
You could still hear.
And I could hear the machine beeping, you know, over here to my left-hand side. And so I knew where it was, but when I had this experience of this brilliant white light, I couldn't tell you where anything was. I could just tell you that I knew the presence was there and that I could still hear them talking. And I repeated to Dr. Carlson some of the things he said, like when he was in the operating room, and he said, "This is a real mess." And he said, "I feel so bad, she's so young. I just don't think she's going to make it at all, but I'm sure going to try to sew this all back together for her." And then they couldn't sew it together anyway. They had to just lay it together and put dressings over it
and see if
and
it would
hope
heal.
that it heal together. But I came to. I mean, I was breathing on my own while I was in intensive care, and my heart was beating on its own and everything, and I was getting stronger every day. I just didn't come to.
All right, so in your professional opinion, with all of these years of experience, all or most of the NDEs that people are talking about can be explained due to the firing of the synapses and the
Muscle twitches,
gases.
Yes, absolutely. Eyelids opening, you know, a lot of people die, their eyes are open and you close them for them. They don't stay closed. You have to sew them shut. Otherwise they could open up if, you know, just because it's only skin and doesn't have a whole lot of musculature to it. So if you're laying in the coffin and you've been dead for a while, I mean, basically everything hardens anyway and gets cold and hardens. But if it does it at a point where it's open and you're like this and you're staring at people, people can stand there and say, he's still alive. My God, he's looking right at me. That's why they sew the eyelids shut. That also has to kind of sort of come back to people connotate that with putting the coins on there to keep the eyes closed. Now we sew them shut. And we sew the lips shut as well.
So I remember talking to this guy who was in a battle, and he had shot this other enemy soldier, and he went up there, and he could actually see where it was like one moment there was this awareness, this consciousness there, and then the next minute it's like gone. It's like something.
Now, Robert, I'm not saying that there can't be out of body experiences. That's not what I'm saying.
Right, right.
I have just never witnessed one. I'm not saying that at the time of actual death, where your spirit hasn't completely left the scene, so to speak, you know, that you have this intense physical attachment to your mortal remains yet, okay? You're at that brink and you're above, and I don't disbelieve people when they explain it, not after what I would had my own personal experience. I'm not saying I was out of body because I don't believe I was. I couldn't see myself.
Right.
Where other people explain that they're in this bright white light and they can see themselves and see the doctors and see them working on them and things like this, and that they don't want to leave and they hang around.
That wasn't your experience.
And then they do survive, you know, and they're able to talk about it later, that they started to go towards this light, and a loved one would say, "Not yet, we're not ready for you yet, but we'll be here whenever you are. We'll be here to welcome you with open arms." You hear those kinds of stories. I don't disbelieve it.
Right.
I just have never witnessed it.
But you were in a position where you were able, even though it looked like you could go at any time, that you were still consciously aware of people around you, what they were saying. You actually probably told the doctor, "Hey, I heard something."
Oh, I did. I repeated word for word some of the stuff he said, and
Was he shocked?
So humiliated.
Oh,
He said, "You know, we've always said the hearing is the last thing that goes." He said, "And you're a perfect example, you know, to validate that statement." He said, "Your hearing was excellent." He said, "You just couldn't open your eyes. You couldn't do anything, couldn't move. If I
Couldn't
could
even
have
move
just
it.
flicked the side of the rail with my pinky or anything to make noise to let them know that, hey, I'm okay."
but you were trying.
I was trying, just couldn't do it.
Couldn't wiggle a toe, couldn't do a finger or anything.
Well, and I think that's, at that point, that's what scared me more than anything, was the fact that I thought that I was going to be paralyzed, completely paralyzed from the neck down, and not be able to do anything at all.
Wow. Wow. But in this time in the hospital dealing with patients, nothing extraordinary, unexplainable. You just were getting reports that so and so lifted up out of bed, sat back down.
Well, and a lot of that I would get from going to like continuing education classes through nursing or through EMT Association.
Which was constant in your case.
Yeah, and we as EMTs, because I became an EMT as well as an RN, and you know, we worked directly with the ambulance service, and we would go and sit down with doctors and listen to lectures and things like that, and hear about people who actually sat up in bed and turned their head and looked and then laid back down, and that was it. You know, so it's like one last ditch effort maybe to try to, you know, linger on or whatever, and it didn't work. And, you know, scared the doctors halfway batty. But a lot of the stuff is explainable, and in some cases, some of it's not. I mean, how do you explain somebody that's completely unconscious, laying on an operating table and can't move, but can turn around and explain what they could see you do? And there's bandages on their face now, and you can't see anything, but they can explain exactly what you did to them and how big the wound is and where it is and everything else.
I have no.
And tell the doctor this and say, "I was above you, and this is what you said, and the anesthesiologist said this back to you," and whatever.
I can't explain none of it.
And so it's like,
I do know that
can't deny it happened because you're repeating exactly word for word what they said.
I know that near death is no death. I mean, death is irreversible. It's that point when you will never come back. But
at a point in time, death is irreversible. Once you have deprived your brain of oxygen for 6 minutes or more, then you are considered clinically dead. Can you still be alive, or can you still be revived to a certain extent? Yes, and then you're on life support and the machines are doing everything for you. That's not life. That isn't. That's robotics, if you want to look at it that way.
And you were running into that too.
Absolutely.
And that's where these end of life directions come in. And
That's when your living will comes into play as to what you want done. How long do you wait if you're in a coma to see if you're going to come out? How many times do you have to have an EEG done to measure brain waves and brain activity in order for somebody to believe that you are brain dead and you will never function without the machines?
now, sometimes when there is no agreement like that end of life agreement or living will, or advanced directives, I guess what they call it,
Mm-hmm.
then the family will be presented with that choice.
Well, that's when they come up with wanting to know if somebody wants to be a proxy. And then you become a proxy to say that you will make the decisions, you know,
In that,
and hopefully they choose somebody that, how do I want to say this? They need to choose somebody who is not emotionally and psychologically attached to the patient. It
Or
can still be a
financially.
relative. Well, financially isn't so much a consideration, except if you're going to end up having everything left to you. I'm talking about a family member who becomes a proxy. It could be a brother who is capable of making the decisions and making them, being informed and make the decisions for the best interest of the patient and not the best interest of the mourners standing around. And that's what a proxy is supposed to do. That's what a durable medical power of attorney does as well. So you can have a durable medical power of attorney assigned, and I was John's. My son Sean is mine, and my other son Mike is my second one, in case Sean isn't available. And so then there's advanced directives. Those advanced directives say things like I am or I am not a DNR, which means do not resuscitate. Advanced directives also state that you can say, I want to be in comfort, so I want the pain medication and things like that that will keep me comfortable.
water.
And I want to have some water and not necessarily food because you can't chew anymore. See, John quit eating. I mean, for months prior to his death, I had a hard time getting him to eat anything at all. He would take a spoonful here or there, maybe 2 or 3 spoonfuls at a meal. And the first one tasted really good. The other 2 didn't taste. He said, it doesn't taste right. And so he would stop eating. Well, he was at the point where they call it failure to thrive, where your muscles start to break down. You've lost not only all of your fat layer. By the time he died, he only weighed 120 pounds.
Wow.
I actually have a picture I can show you that I took